Today I will talk to you about the various ways in which we as neurosurgeons deal with a brain tumor. So when we talk about a brain tumor, first thing that comes to our mind is brain surgery. That could be true to a large extent, but the treatment that we really come up with would change as per the type of tumor that we expect it to be, as per the age of the patient, the clinical condition of the patient. So the treatment that we offer varies in different circumstances. To name the different type of management that we do in a brain tumor, I would like to enumerate them. First one would be where we are just observing the patient. A tiny tumor which we expect to be benign, we follow up them for years. At times, these tumors never deserve any treatment at all. The patient can be kept under observation for a long time without the tumor showing any change. But yes, if there is a change, then we also change our modality of treatment. The second would be a surgical excision, where we see the tumor, we excise the tumor. Third would be radiation. Direct radiation is offered in very few cases. So we do not like to radiate any tumor without knowing exactly what it is. So in most of the cases, we do a biopsy before we subject them to radiation. And again, most of these, we do make an attempt to remove as much as possible, and only the residual tumor is radiated. Yes, tumors around the brainstem or diffuse brainstem tumors are obviously better radiated because the possibility of excision of the tumor almost doesn't exist. The fourth modality of treatment would be chemotherapy. Again, chemotherapy is also extremely useful in some specific forms of brain tumors, but it is not always used, and it is always used in conjunction with a biopsy of the tumor or along with radiation. So the most common factor which comes across all these things would be the need of a surgery. So surgery is the most common modality that we use in a surgery applicable to almost all types of brain tumors. It could be in the form of a total excision, it could be in the form of a subtotal excision followed by radiation, and it could also be in the form of just a biopsy of the lesion where we know exactly what type of lesion are we dealing with, and then subject the patient to chemotherapy or radiotherapy depending on what would suit the patient the most. So this is it in short about the various types of treatment that we normally offer to patients with brain tumor. Thank you.